Excision of the urethral caruncle is a benign lesion or inflammatory prolapse of the external urinary meatus in the female. A urethromeotomy or meteoplasty is a small incision of the urethral meatus to relieve of stricture. Dilation of the urethra is usually done with a Van Buren sound to make it easier to insert the other instruments and to relieve strictures. A urethrotomy is an incision of the urethral stricture with a urethrotomy, and a urethroplasty is reconstructing the urethra, usually with grafting. Extracorporeal shockwave lithotripsy uses sound waves or shock waves to break up or crush kidney stones and that are then discarded through the urine. This is a non-invasive procedure. Laser lithotripsy is a minimally invasive method for breaking up stones. It uses laser instead of shock waves. Lasers have the ability to break up the stones without damaging soft tissue. This method can be used during percutaneous nephrolithotomies or uteroplioscopies. Prostatic enlargement may be benign or malignant. As the prostate grows, the tissue will encroach on the urethral lumen, causing obstruction of the urinary outflow. Many factors are considered when determining the best approach for removal of the obstruction. If the prostate is cancerous, a radical retropubic or radical perineal prostatectomy can be performed. A TURP, which is a transurethral resection of the prostate, implantation of radium seeds, or cryotherapy. If the enlarged prostate is benign, BPH, or benign prostatic hypertrophy, it can be removed by a retropubic prostatectomy, suprapubic prostatectomy, perineal prostatectomy, or TURP with or without laser. BPH is not cancerous but can cause obstruction that can cause reflux or backflow of urine, infection, and difficulty voiding. A TURP is a typical treatment for this condition. This procedure is done in the cysto room with urethral sounds, resectoscopes, and a loop electrode with cautery. Therefore, glycine or some other non-electrolytic fluid is used. Clots can be evacuated with an Elec or Toumey syringe. A TURP can also be done for cancerous prostate on patients that cannot have a radical prostatectomy or to relieve symptoms. Circumcision is a removal of the prepuce of the glans penis and is done to improve hygiene and because some cultural and religious beliefs. Uncircumcised male may develop a number of conditions that affect the glands and foreskin. Chapped skin can lead to infection and scarring that can result in phimosis, the inability to retract the foreskin. Paraphimosis, or the inability to return the foreskin to its normal position, can also lead to a circumcision. This procedure can be done under MAC. If locals use, epi should never be used on the penis. The suture of choice is a 4-0 or 5-0 absorbable suture, and the wound is dressed with a petroleum gauze or zero form. Hypospadias is a birth defect where the urethra opening, the meatus, is on the underside of the penis instead of on the tip. The underside is also referred to as a ventricle. Surgical repair usually begins at 1 year to 6 years of age. On the other hand, an epispadias is a congenital anomaly in which the urethral opening is on the upper side or dorsal side of the penis. A penectomy can be a partial or total removal of the cancerous penis. Which type depends on the extent and involvement of the disease stage. Afterwards, reconstruction may be possible. Penile implants are placed to treat impotence usually caused by a neurological disease, diabetes, vascular disease, or psychological issues. Many medications can also cause impotence, and men will refuse to take their medication for this reason. There are many types of penile implants available through various manufacturers.